as is the convention, for 30-minute debates. Sarah Champion to move the motion.
Thank you, Mr Davies. As ever, it is a pleasure to serve under your guidance. I beg to move that this House has considered sexual and reproductive health rights and overseas aid. The Minister is well versed in this, and he knows it is essential that we ensure that women and girls are empowered to make decisions about their own bodies, that they are free to pursue education, employment, and to prosper in their chosen path in life, wherever they are in the world. This is a cause I care deeply about, and I am delighted to have sexual and reproductive health and rights, SRHR as I refer to it as a key priority this year for the International Development Committee, which I chair. As part of the committee's inquiry, we're very much looking forward to hearing from the Minister of State for Development and Africa on this issue in September. As a current inquiry, I'll be focusing on a separate piece of work largely today carried out by the Royal College of Obstetricians and Gynecologists, RCOG. I will, of course, still refer to evidence that's been submitted to IDC. Last week, I had the pleasure of hosting the launch of RCOG's new report, Getting Back on Track, the case for renewed investment in global SRHR. The report notes the achievements of UK advocacy, leadership and overseas aid for SRHR over the last decade, as well as the impact of recent aid cuts for SRHR and gender equality. The testimonies from RCOG members and other healthcare professionals working on women's health around the world who experience the devastating impacts of cuts on the front line are essential to understanding this issue. I strongly encourage the Minister and his officials to closely consider the report's findings and recommendations. The moral obligation to support women and girls in HRSR is clear. Body autonomy is the foundation upon which women and girls can exercise their full rights. It is infuriating that we are seeing women and girls' rights being rolled back in some part of the world. This shows us that the UK's advocacy for global gender equality and SRHR has never been more important. My committee has heard from several organisations about that importance of UK's overseas aid to delivering comprehensive SRHR services and achieving universal access for every woman and girl. UK aid can and does make a real difference to the lives of women and girls around the world, but we must continue and expand our support in a sustainable way. It's important to look at this issue through an intersectional lens. The committee has heard that the most marginalised face additional barriers to accessing sexual and reproductive health services. For women with disabilities, often services are not delivered in a way that is accessible to them. For example, as simply as there not being a wheelchair ramp into the clinic or sign language interpretation. LGBTQ+ people can also find it difficult to access service due to stigma, discrimination and even criminalisation of same-sex relationships and gender expression. We must do all we can to change this, and I'm very proud that our embassies around the world do stand up for those rights. Investing in SRHR is not only the right thing to do, it also makes financial sense. Research by the United Nations Population Fund, UNFPA, shows that for every dollar invested in family planning and maternal health in low-income countries, over $8 is accrued by averting unintended pregnancies and reducing the demand for and cost of maternal and other health services. Organisations like the UNFPA are vital actors in the SRHR space, which is why it was so disheartening to hear them tell the committee recently of the devastating impact of UK government cuts on their services. In 2021, with very little warning, UK aid to UNFPA's supply partnership was cut by 85%. Their only clue as to what was coming was from the media reports about the UK's reduction in ODA spending from 0.7 to 0.5. UNFPA provide 40% of the world's contraceptive supply, reaching approximately 20 million women and young people every year. They told the committee that, because of the loss of funding, they had to immediately cut the commodities that they provide, contraceptions, by 30%, and have since had to make sweeping cuts across the board. While there's been a partial restoration for funding to UNFPA supplies, the UK government ultimately remains off track to meet its 2019 commitment of £425 million, with support for the UNFPA's core operating fund still remaining significantly reduced. So I ask the Minister, will he make a commitment today that the UK Government will restore support to UNFPA's core operating fund alongside the existing commitments to its supplies partnership? Supporting women and girls to take control of their reproductive health is essential to achieving the UK's international development objectives, in particular its ambitions for gender equality. Government investment must reflect that. What is so desperately needed, and I do understand the Minister knows this, is action, not just empty promises. Women and girls being able to access their reproductive health rights also underpins the success of all three of the ambitions of the FCDO's Women and Girls strategy. Girls with access to education, safe and sensitive contraception and abortion services are less likely to drop out of school. Enabling women and girls to choose if and when they have children frees them to pursue employment and to participate more fully in social and political life. And empowering women to make decisions about their SRHR is also essential to tackle gender-based violence. In their new report, the RCOG makes the case that if the UK Government is to be successful in achieving its key aims within the Women and Girls strategy, they must be matched with dedicated and sufficient long-term funding. Otherwise, it simply won't work. I will, of course, give way to my former IDC committee member.
Honourable friend for giving way, and she's making a good speech. I congratulate her on securing the debate. One area, though, that the Royal College of Obstetricians and Gynaecologists have focused on in the past, and rightly so, are the high rates of maternal and indeed newly born baby morbidity and mortality in many low and middle income countries, particularly in Africa. And I just wondered if she may address that point and make some suggestions to the Minister about how Britain, through its aid strategy, can better support that agenda and improve safety around pregnancy and childbirth.
Sarah Champion.
I will indeed cover that, and also benign gynecological conditions, another major killer for women. But can I congratulate my honourable friend for all the work he's done on global health over the years and continues to be an advocate for in this place. UK aid has contributed significantly and meaningfully towards ensuring all women and girls can access their sexual and reproductive health and rights, and we should all be proud of that track record. RCOG members in Pakistan, who've been providing training as part of the UK Women's Integrated Sexual Health WISH programme, reported dramatic increases in access to safe abortion care, post-abortion care and family planning by those who participated in their schemes. However, the decision to cut ODA threatens to stall or even reverse this progress around the world. WISH is supposed to be the government's flagship sexual and reproductive health programme, but even that is not safe from the cuts. MSI Reproductive Choices had their funding under the WISH programme slashed by 78%. My committee has also heard that a 3-year health programme for the most marginalised communities in Bangladesh received £1.1 million cut to its £2 million budget, 2 years in with no notice whatsoever. A direct grant in Ghana, which was providing safe birth, child health and psychoeducation for pregnant women and mothers through building new maternal health self-help support groups and outreach clinics, received a 25% cut. The government are not putting their money where their mouth is. The most recent data shows that bilateral spending on SRHR decreased by over 50% from £515 million in 2019 to £242 million in 2021. Minister, you're aware this is not good enough. I'm aware you're trying to change it, so I look forward to hearing more in your remarks, if possible. Estimates by Guttmacher Institute suggested that cuts could have already resulted in 9.5 million fewer women and girls having access to modern methods of contraception, leading to 4.3 million more unintended pregnancies, 1.4 million more unsafe abortions, and, as my honourable friend said, a possible 8,000 more avoidable maternal deaths. Countries with the greatest need for SRHR funding and programmes have been hit the hardest by cuts. Within these countries, the most marginalised are often the most effective. As Professor Friday, an obstetrician and gynaecologist based in Benin, Nigeria, described in the ARCOG report, it's the most marginalised people who are reliant on donor-funded services. In Nigeria, where nearly 80% of health payments are out of pocket, the loss of funding from the UK government has only widened this dire gap in services. Making donations towards SRHR in humanitarian crisis is not enough. Welcome, but not enough. UK support must be in the form of sustained programming that delivers against its commitments to the UN Sustainable Development Goals and promotes the health of women and girls as the backbone of international development. As recommended by ARCOG, will the Minister make a commitment to restoring funding for SRHR and spending £500 million each year on SRHR programming and supplies for the next 3 years? As well as restoring investment in SRHR, the ARCOG is calling on the government to strengthen its global advocacy on SRHR by investing in new and existing global partnerships and collaborations. The UK's financial commitment to the Family Planning 2020 initiative had a significant impact on the global funding landscape for SRHR and contributed to enabling an additional 24 million women and girls to access family planning services. So I ask the Minister again, will the Minister make a financial commitment to the Family Planning 2030 initiative to continue its success? It's only by linking our national actions to global level goals and commitments that we can hope to achieve a truly universal access to SRHR for every woman and girl. As well as being one of the largest donors in support of SRHR supplies, the UK has also been one of the most progressive in its advocacy. The ARCOG is calling on the government to strengthen its global advocacy on SRHR by championing stigmatised issues, such as abortion care. This is something I care deeply about, particularly as we are seeing abortion rights being rolled back around the world. I was proud to see the UK co-lead a statement at the UN General Assembly last year on the importance of respecting the body autonomy and SRHR of women and girls. It's also been so reassuring to see the UK government commit to prioritising safe abortion care as part of its commitments to supporting SRHR in the Women and Girls strategy. Mainstreaming safe abortion services and post-abortion care is essential to reducing maternal morbidity and mortality. Unsafe abortion remains one of the world's leading causes of maternal mortality. The risk of dying from an unsafe abortion is highest for women in Africa, where nearly half of all abortions happen in potentially dangerous circumstances. In his response, can the Minister say how the government plans to champion safe abortion care within its own programming, as well as through national universal healthcare plans, as part of a health system strengthening efforts? We've seen the success of telemedicine for early abortion care in the UK. Guidance from ARCOG, as well as the WHO and other authorities on clinical standards, all affirm that telemedicine is a safe and effective delivery model for expanding access to abortion care. The ARCOG has encouraged the FCDO to invest in telemedicine and self-management for abortion in settings where it can provide safe additional pathways to increase access. I would also like, as ARCOG have suggested, to see the UK government champion the prioritisation of gynaecological health needs of women and girls on the global health agenda. I will, of course, give way.
Debate, and can I ask if she agrees with me the government is right to commit to focus spending on women and girls, and particularly maternal mental health, but also to call for the UK to publish a voluntary national review on the Sustainable Development Goals, given the importance of this subject?
Sarah Champion.
I absolutely support what my honourable friend, committee member and chair of the ICI subcommittee is saying. My honourable friend has always been a champion on these issues, and I think the Minister has heard what she has said. The FCDA's programming does not currently address the global burden of gynaecological disease as a priority in its own right, nor as a key element of its integrated SRHR response. Minister, this is a glaring omission. Forthcoming ARCOG research shows how the overall morbidity for women and girls due to so-called benign gynaecological conditions outweighs and I was stunned when I heard this, Mr Davies, outweighs the combined morbidity from malaria, TB, HIV and AIDS in low and middle income countries, but it's not in FCDO's strategy at the moment. There is an urgent need for the UK government and donors around the world to afford gynecological disease the same priority as maternal morbidity and diseases such as malaria, TB, HIV and AIDS. And I wonder if the Minister could look into this, please. As a first step, the ARCOG and I are seeking to commitment from the UK government to champion this by investing in the collection of data and research on the scale of the burden and to build strong evidence from which to build future investment. Investing in quality SRHR training for all healthcare workers should be a top priority. At present, the workforce is meeting only 41% of the needs of low-income countries. A lack of skilled workers is a major barrier to making universal health coverage a reality. I really welcome the government's commitment to strengthening the workforce as part of its contribution to this agenda. But, as ARCOG recommends, we need greater investment in supporting task shifting and task sharing between different groups and levels of healthcare workers. This is essential to addressing shortages and to support the delivery of comprehensive and integrated SRHR services, including expanding access to abortion care, long-acting reversible contraception, supporting diagnoses and the treatment of gynecological diseases at the earliest stage. This new report from ARCOG is an important reminder to us all, but to the Minister as well, of its responsibility to women and girls around the world who rely on our government's support for their essential healthcare. It should also serve as a call to action for restoring the progress that's needed to achieve the universal access to SRHR. I urge the Minister to seriously consider the report's recommendations for investment, as well as the points that I have raised today. We must stand together alongside women and girls everywhere and continue to advocate for their health, their empowerment and their equality. Thank you, Chair.
The question is that this House has considered sexual and reproductive health and rights and overseas aid. Minister.
Mr Davis, it's a tremendous pleasure and indeed the first time that I have appeared before you in one of these debates. And of course, this is a subject which you and I have discussed many times over the last 10 or 15 years together. So I know that you take a great interest in it. But my pleasure at appearing before you is exceeded only by the pleasure at being able to respond to the Honourable Lady, with whom I have many interactions and whom, as she knows well, I agree with on a very large amount of what she says, never more so than today. And I pay tribute to her both for securing this debate and also for the work that she does on the International Development Committee, together with the membership of that committee, which, as she well knows, is widely regarded as amongst the most expert of any committee that sits in the Houses of Parliament. I look forward to giving evidence to her committee in September as part of its inquiry into the important matters we are discussing today. And if I don't answer in sufficient detail some of the points that she has made today, I know perfectly well that she will pursue me on that when I appear before her committee. May I also thank her for what she said about the work of British diplomatic missions overseas, and I will pass on to the missions her generous words, which I know they will appreciate. And can I also underline the point that was at the heart of much of what she said, that as a result of the reduction in the ODA budget from 0.7 to 0.5, there were incredibly difficult decisions which had to be made. They imposed an enormous strain on what are now, but weren't then, my officials. And in following the will of Parliament that it should be cut, many extraordinarily difficult decisions were made. But I think today we are in a better position than we were, and I hope that will become clear in what we have to say next week in some of the reporting back to Parliament that we will be making. Mr Davis, every woman and girl should have control over her own body and her own life. She should be able to make informed decisions about sex and whether and when to have children. She should have access to good quality sexual and reproductive health services and be able to realise her rights. This is far from the case for too many women in too many countries. And this is why universal access to comprehensive sexual and reproductive health and rights forms an important part of the British government's approach to development and diplomacy. Our commitment to promoting these rights is set out in our strategies on international development, global health, and women and girls, and it is a central element of our approach to ending preventable deaths of mothers, babies, and children. And yet we face many challenges in achieving our aims. Global progress on reducing maternal death rates has stagnated between 2016 and 2020, even before the impact of the COVID-19 pandemic. And this is why I am championing our efforts to help end the preventable deaths of mothers, babies, and children by 2030. This campaign joins up efforts right across the system, from water, sanitation, and hygiene to good nutrition, from clean air and access to new health technologies to a supportive environment for sexual and reproductive health and rights, as she set out so clearly in her speech. Let me now turn to the worrying trends that are putting the progress we have made on sexual and reproductive health and gender equality at risk. Attempts to roll back the rights of women, girls, and members of the LGBT+ community are increasingly well-funded and well-organised. We are determined to confront this. Britain is a proud champion for these hard-won rights. We continue to promote and protect them around the world, working closely with our allies, including in the multilateral sphere. We must challenge the lies, polarisation and division that are undermining that progress. So this is why the UK led a landmark joint statement at the UN Third Committee last October, along with 71 global partners. We committed to work tirelessly to advance gender equality and to support the rights of all women and girls. And at this year's Women Deliver conference in Kigali, the UK will help catalyse united action to resist this rollback on women and girls' rights and to further gender equality. There is much to do, but there is cause for hope, and the UK has a key role to play. I turn now to another challenge which we face, which is reduced domestic government funding for sexual and reproductive health and rights, prompted by the COVID pandemic and crises around the world. We know the UK's official development assistance has also reduced. The government's policy remains to get back overseas spending to 0.7 when the economy allows. But in the meanwhile, we are doing as much as we possibly can to find multipliers to help enhance and augment our own taxpayers' money. And we've set a strong pathway towards this through our strategies on women and girls and ending preventable deaths. We remain a key supporter of sexual and reproductive health and rights with a significant portfolio of programmes and policies. For example, through FP 2030, the Global Family Planning Partnership, the UK is supporting partners around the world to advocate for better access to family planning. The Global Financing Facility supports stronger, more sustainable access to health systems. The Women's Integrated Sexual Health Programme has supported more than 9.5 million women and girls in Africa and Asia to use modern methods of contraception. And the UK remains a world leader in efforts to end the AIDS epidemic, including through our health system strengthening work, our work to end preventable deaths, and through support to the World Health Organization and the Global Fund to fight AIDS, TB and malaria. We are pushing for equitable access to comprehensive sexual and reproductive health services, dismantling barriers to access, targeting underserved groups, and champion SRHR for all. I will, of course, give way.
Thank you. On the FP30 and the Women's Integrated Health, I wonder if the Minister could talk a little about the financial commitments that go along with the policy-leading commitments.
Minister.
What I can certainly say to the Honourable Lady is that we will do everything we can because, as she set out in her speech, this is a very high priority for the government. We will do everything we can to make sure these efforts are adequately resourced. The Foreign Office and other donors do, however, have to adapt our approach to ensure that financing to this work is sustainable. And this means placing accountable country leadership and investment at the heart of our development agenda. For example, the UK has provided over £200 million to the UNFPA Supplies Partnership since 2019 to improve the availability, quality and supply of life-saving reproductive health products, including family planning, safe abortion, about which she spoke extremely eloquently, and maternal health medicines. Over the last 2 years, the UNFPA Supplies Partnership has successfully secured domestic financing commitments from 43 low and middle income countries towards their own reproductive health supplies, totaling $26.4 million, many committing for the first time. The final element of our approach is ensuring that our efforts on sexual and reproductive health are fully integrated within our broader work to strengthen health systems. This was set out in our G7 Health Ministers' communiqué in May. We and the other member states committed to universal access to comprehensive health services at every stage of life, including maternal, sexual and reproductive health. In making this pledge, we recognise that these services are a vital part of achieving the UN Sustainable Development Goals. And if I may conclude, Mr. Davis, we are acutely aware of the challenges we face in advancing this work, many of which were set out so eloquently by the Honourable Lady. Yes, I'm perorating rather than finishing, but of course I give way.
I know the Minister well. If I could ask him, if not to comment now, then if he could do some research when the RCOG report into the benign gynecological conditions comes out, because I was genuinely shocked, Minister, to discover that it was killing more women than the other major diseases combined, and that we're not focused on that. If the Minister could make that commitment to look into it, I'd be extremely grateful.
Yes, I will certainly look into it, and I was extremely struck by what she said in her speech about the scale and the comparison which she set out so clearly for the House. Mr. Davis, despite these challenges, the UK continues to prioritise work on sexual and reproductive health and gender equality across the full span of our development and diplomatic work. This includes targeted support to reduce maternal mortality, determined efforts to reduce the rollback of SRHR and women and girls' rights, and work to secure sustainable financing. We will continue to advocate for the world's most marginalised and underserved people to secure rights and choices for all. And I want to emphasise, Mr. Davis, finally, that in trying to understand how you make progress on international development, the aims that Britain seeks to drive forward, none of these things can be understood unless they are seen through the eyes of girls and women who suffer first and hardest from the extremes of poverty. And a particular aim of the government in respect of putting girls and women at the forefront of everything we do is to try to ensure that we get as many girls into school as we possibly can. And as I told the House this morning, in the last 5 years, for which figures are available, we were able to procure the education of more than 8 million girls. In focusing on family planning, ensuring that women have the ability to decide for themselves whether and when they have children, and in bearing down on sexual violence against women, all sexual violence, but particularly in the hideousness of conflict. And those three aspects of our policy, Mr. Davis, help drive forward what we believe is the critical battle of our times, to try and do something about these appalling discrepancies of opportunity and wealth which disfigure our world today.
The question is that this House has considered sexual and reproductive health and rights and overseas aid. Does anyone have that opinion say aye? Aye. To the contrary, no. I think the ayes have it. The ayes have it. Order. Order. We will start the next debate in a few seconds' time at 4:30.